We are going to move things now to the public commentary period. Before going into that, we're working you guys really hard and keeping you on a tight time frame. And because of the rules, we can't provide you anything other than water and coffee, but I can. So I bought some snacks and some drinks that are over there. So if your sugar level's low, there's a larger order coming in a little under an hour, which will keep your sugar levels up also. So I just want to thank you again, because I know we're working you hard. We have 22 speakers lined up.
24.
Oh, I thought the last two aren't.
No,
they're added. We have a math problem. We have 1 hour to get through 24 speakers. And if you do that math, we can't do that with 5 minutes, and we really can't even do that with 3 minutes. But I'm going to ask people to keep this to 3 minutes. And nobody likes being a time cop, least of all me, but we're going to have to be a time cop. And we recognize that the speakers that are on the phone don't have the little blinking light and the timer that we all see. So we're going to have to do it from here. What I'm going to ask the speakers to do, please, is pull out your smartphone, pull out a watch, and before you start talking, please time yourself. And let's keep this to 3 minutes and pace yourself. Please, if you will, make sure that we get in the salient bullet points that you want this committee to hear. What are the take-home messages you want us to hear? We've heard a lot of compelling stories about what people have gone through, and they're incredibly emotional, and I know everybody wants to tell their story. I just don't think we're going to have time for all of it. Now, I was just asking Kathy, is there going to be opportunities for other public comment period? And that's still a discussion point. At the very least, we are going to be continuing to accept written comments. We want to hear your voice. I think we have been very impressed with the outpouring of interest in this space and want to thank you. So let's just now dive in and start with Mark Schmidt. Mark, are you on the line? And we're going to be following by Karen Morin. Mark?
They unmuted me.
And maybe we should just move on to Karen Morin. So, Mark, if you're trying to get on, you can connect perhaps a little bit later. Karen, are you on the line?
Yes, I am.
Great. The floor is yours, Karen.
Okay, thank you. Hi, my name's Karen Morin. I'm 55 years old and permanently disabled. I've been living with TNJD for over 40 years, and I've already submitted my story to NAM, so I encourage you to read them. And before my implant nightmare started, I was engaged in physically very active, and of course I know a student in chiropractic school. I've had 35 jaw-related surgeries that have included 10 bilateral total joints, 13 implants for discs, mandibular angle, chin augmentation, made of Silastic and Teflon Troplast. My first implant surgeries were in '88 with 4 Dow Silastic discs. My first set of total joints were Ditech DK2 Teflon Troplast that were implanted after the FDA recall with revision 2 years later. I was never notified of the recall. I'm new to Arizona, 18 years spent trying to fix the damage done by the foreign body giant celiac. The ribgraft failed, and because I couldn't have synthetic material, they used custom titanium metal-on-metal Christiansons. All 6 sets failed to implant loosening, infection, and heterotopic bone growth. In 2011, I moved back to Texas and took 6 years to find a surgeon that was willing to work with me. When I discovered that the Christiansons were not titanium, but stainless steel with nickel. I was devastated after 30 years of fixing my joint that I was once again betrayed. The surgeon did a polyethylene test, and that was negative, but my hypersensitivity test was highly reactive to nickel, so he ordered custom nickel-free concept joints. In the last year, I've had 6 surgeries to renew the broken implants, and they advanced my lower jaw 33 millimeters, had my third osteotomy in January, and 3 post-op complications, and the last one was 3 weeks ago where they renewed 4 former lunch teeth. I had to withdraw from chiropractic school, my clinical residency in 1993 with 6 months left to graduate because I could no longer multitask. I saw a specialist, and he said that my immune system was attacked and broken down by the immune system was attacked by the Teflon and Celastic, which attacked my myelin on my central and peripheral nervous system, causing seizures, cognizant-deficit central apnea, chronic immune demyelinating polyradicular neuropathy, or CIDP. I have lots of other ailments that I can't get into because I don't have time, but I've been tractable pain for a very long time. My current pain management doctor is weaning me off of my meds because he thinks because I had my jaw surgery that I don't need any pain meds anymore, even though my specialist told him that I need it for life.
Karen, do you have, sorry, again, apologies for cutting you off, but are there any final recommendations to the committee that you would like to have us hear?
Yes. Where's the standard of care? What is the FDA doing to prevent another Zytec and Celastic disaster? Where is the patient registry to track implants and other devices? Why are patients not given a card with the serial and model numbers of their implants? And I'm simply horrified that this type of implant disaster can happen in our country where we have rigid standards for a reason. These patients were abandoned to deal with the outcome of empty, unfulfilled promises from the FDA and other governing bodies when other interests come before patients' well-being. This has got to stop.
Karen, thank you. Thank you for your time.
Okay. I appreciate it.
I believe that Mark was muted on our side. And Mark, can you hear us? I'm sorry. Can you repeat that?
Okay, her mother here. His mother is Joanne.
We'll go to Joanne Morin.
And then go to
So we're going to go to Joanne Morin next, and then followed by Mark Schmidt. So Joanne, take it away.
Hello. My name is Joanne Morin, Karen's mother. Being a caregiver is a full-time job. You need to be there 24/7 and still be available for the rest of the family. When our 4 children were at home, it was a little easier to be there for everyone. When Karen's TMJ problems started in high school and increased through college and into chiropractic schools, she had to have travel from Chicago to Wisconsin and St. Louis for TMJ treatments at our expense. Our insurance would not cover this because they said it was a dental issue, which of course it wasn't. Karen consulted an immune specialist in Texas who diagnosed her problems as being directly related to the Celastic and Teflon implants. He ordered IVIG infusions, which were paid for by us after 10 years at a cost of about $120,000 total. She also saw an oral surgeon at Methodist Hospital in Houston who said she needed Vitec total joints, which we later learned had been recalled prior to her surgery. She was part of a class action lawsuit against Methodist Hospital for her role in Vitec research. Karen moved to Arizona when we were going to retire there. Her surgeon in Arizona was very good and treated her for years. It was hard to watch her suffer all this time, and I felt helpless and could only console her and support her when she was depressed and feeling sorry for herself. It hurt me to my core to be so helpless. Eventually, Karen applied for SSI disability and Medicaid. We had problems getting a lot of items covered, but with the help of her surgeon's testimony during several hearings, we were able to get a lot of items covered. Karen needed to be seen by a restorative dentist to correct her bite, so we ended up paying $65,000 for this treatment under general anesthesia. My husband retired in the mid-90s and then consulted in California for startup biotech companies. At that time, Karen could not drive due to her seizures, so friends and her youngest son's wife would take her to her doctor's appointments when we were gone. One day, Karen called me all upset because her sister-in-law had chewed her out about being lazy, not trying to work, and instead let us support her. I was horrified. I told Karen to talk to her brother and wife together and to tell them in great detail all her problems.
Joanne,
They all
as
ended
a
up
caregiver,
crying.
Joanne, I'm sorry to cut you off.
Yes?
As a caregiver who's been caring for Karen for some time, very compelling story. Are there some final recommendations or suggestions for the committee that we can help take some action on? Final
I would
closing
like
bullet.
to say that there needs to be a standard protocol to follow for placing implants. Manufacturers need to be honest about the materials used in their implants and in research testing. It would save a lot of heartbreak for patients and caregivers. Being a caregiver is no fun. You want to be there, but you need to have some time for yourself, or you may not be there for anyone ever.
Thank you,
Knowing you
Joanne.
are loved and cared.
Joanne, I'm sorry to have to move on, but thank you for the very powerful messages. At this time, we need to move on to Mark Schmidt.
All right, thank you.
Thank you. Have we got Mark on the line? Mark, the floor is yours.
Hey, can everybody hear me now?
Yes, thank you.
All right, great, thanks. My name's Mark Schmidt. I'm Lisa Schmidt's husband, and I wanted to talk to you today about a few salient points as we keep hearing. So the feeling of helplessness is very real for those of us who work with the caregiver of the folks that are having TMJ problems. There's impacts on the kids. You know, as you saw, Lisa had a great career, and then, you know, things went down the tubes basically as soon as she started having TMJ problems. You know, our adopted children, one of them has special needs. She has a lot of care needs that are, you know, going unmet. She comes home sometimes and Lisa's asleep, and, you know, she tries to, you know, get in the house and wakes her up. I mean, I've seen the presentations that you're seeing today. I've been involved for many, many years. It's terrible. You need to come up with a better plan. So, you know, the doctors and dentists, they're still in the OR experimenting. They're still causing havoc, and I don't understand why that's allowed. One time I had to go and drive from Florida to Huntsville, Alabama, so she could get gallbladder surgery, because none of the doctors in Florida would touch her because they were afraid to intubate with the jaw joint. Another time, my mother had to come down and stay with the kids and Lisa and basically take care of her while I was flying for business, because I had to fly for, you know, a couple of weeks at a time for a while. You know, there's lots of impact on others other than just the person having the problems that I don't think the committee fully understands. In terms of health insurance, I've become an expert at fighting claims, writing letters, you know, dealing with human resources. One time I actually had to switch jobs just to get one of her surgeries covered. I had to quit a job we had just moved to Huntsville for and switch jobs from Raytheon to MITRE just to get the surgery covered, because when you're in Alabama, you have to have Blue Cross. The other insurances don't really do anything. So I guess a big picture, I just, you know, any other medical condition like hips or knees, if they had the kind of horrific outcomes that TMJ has had, I mean, they would have been sued into oblivion. I don't understand why that's not happening. I don't understand why there's no recourse a lot of these doctors, they try and charge cash instead of charging for using insurance. That's a clear sign there's something going on that's not, I don't think, ethical. So, in any event, I think I've covered the most salient points. Is there any questions?
Mark, I think we're right at time, and I think we hear your message loud and clear, and there is a recurring message around the fact that pain not only impacts the patient, but also the entire family. Thank you. We're going to move on to Ariadne Braz, followed by Sophia Stone. Ms. Braz?
I believe myself, Sarah Lashley, has been unmuted.
Yes, we can hear you.
I'm not Ariana. I'm Sarah Lashley. I'm down on the list, but I come to you this morning first as a wife of a TMD sufferer, my husband Kurt. In 2006, during our first year of marriage, I was pureeing food for him because his jaw hurt so bad. He had seen dentists and even said no to jaw surgery at the we sought PT therapy first when we got married, and it cost $1,200 for 6 weeks of care. It was not covered by insurance. He had done his own research to try and cure his pain. I discovered he had trigger point therapy workbooks by Claire Davies based on the research of Travell and Simons. And I was like, you can treat this with your hands? So second, I come to you today as a professional massage therapist trained in precision neuromuscular therapy. Because of my husband's condition, I went to massage school, and after 3 years of treating him with precise trigger point therapy and myofascial treatment of the head, neck, and jaw, he finally found consistent relief. Over my 10 years of my career, I have tracked over 200 clients that have finished my treatment plan, and 95% of them find success with myofascial treatment and trigger point therapy. These are not the cases that you've heard about that have extreme pain with the jaw surgeries, but these are the early intervention patients that desperately need the myofascial pain care that Dr. Meredith Berard was talking about. Over 50% of my patients come from dental referral. 50% of the patients that I've seen found complete success. 45% have found maintenance. This is a low-risk, low-cost, highly effective early intervention. It's precise trigger point therapy and myofascial treatment of the jaw, head, and neck muscles. A number of my clients have shared their stories with you via email this week. One of them, Michelle, has seen 7 doctors costing $3,500 over her first 4 months. In her first 4 months of treatment at Soma Vita Pain Relief Center, which is my neuromuscular center, I now have 3 therapists that have treated her. Her treatment costs were less than $700. And as she said in her testimony, we've given her her life back. If she continues 1 treatment a month maintenance for a year, it will be less than $700 a year for her treatment. This is a cost-effective treatment. So I didn't stop there. I lastly come to you now as the PNMT teacher for the TMJ Intensive weekend course. I recognize this is only a weekend course, but we have trained over 500 therapists in 20 years. Myself personally, in the last 3 years, 165 therapists. Most of these are massage therapists. And as Dr. Lilovich mentioned, manual therapy is not covered by insurance.
Sarah, sorry to cut you off here, but we're over time, and thank you for sharing your
Thank you.
perspective, both as a wife as well as a professional caring for people in pain.
Thank you so much.
And I candidly don't know who's next, because we seem to have lost the order. Is Ariadne Braz perhaps on the line? Or whoever our AV tech wants to unmute. or Sophia Stone.
Well, hi. Oh. This is Sophia. Does anyone else want to get a chance to speak?
Sophia,
Right,
we can
will-
hear you. Go ahead. Take it away.
Okay, great. I'll take that liberty. Hi, everyone. My name is Sophia Stone. Thank you for the opportunity to speak. It means a lot to me. So for a few years back, I developed TMJ during a stressful time in school. And at first it was misdiagnosed as eustachian tube dysfunction. But eventually when it was diagnosed, the ENT told me basically that TMJ wasn't life-threatening and I just kind of have to learn to deal with it. I ended up leaving medical school in part because of my pain. And ended up taking and staying in a remote work position. I'd wanted to return to grad school, but I wasn't sure how well I could handle the stress. I'd gone to see dentists about my symptoms and had one made, a mouth guard. And I think it was kind of poorly made. I ended up experiencing muscle pain in my masseters that I hadn't experienced before, and that's never really gone away. They didn't really listen they didn't adjust the mouth guard very much when I complained that it didn't seem to fit very well. And eventually I did go back, and the dentist started shaving down my teeth without my consent, which I didn't really appreciate, so I haven't really returned to that office. And it's been really frustrating over the last couple of years because every time I've tried to see a medical doctor, they'll hand me off to dentistry, and when I see dentists, I haven't gotten a lot of luck for mouth guards, or they'll refer me to a TMJ specialist. I've tried almost everything over a period of a couple of years to relieve my pain, and eventually ended up consulting with a TMJ specialist who ordered a bunch of scans, and afterward ended up prescribing me the exact same $2,000 interior repositioning splint that he makes for every single one of his patients, no matter their symptoms. It made my pain worse, and it's, not like really backed by evidence, so I really shouldn't have been that surprised. And my wallet really took a hit as a result of that too. So anyway, later on I developed some other symptoms. My mouth opening was limited to 1.5 centimeters, developed a lisp, those fortunately went away. Now I'm well managed using Botox, but I might be playing the lottery with my joint health because there's not a ton of research on that. But really what I'd like to convey by speaking today is that TMJ has really affected my life more than any other job, person, or experience. It's really frustrating. The pain is frustrating. It affects my ability to socialize. It affects my intimate life. It affects my ability to network with colleagues. It causes a lot of stress, and it's a really stressful position to be in, especially when medicine and dentistry kind of swap off taking responsibility for its care. Some med students are taught that it's caused by women's promiscuity, which is a harmful stigma that follows patients around. People tell TMJ patients it's just all in their head. So anyway, there's still a lot of progress to be made. I think my story supports the idea that success stories are certainly possible. There's still a lot of work to do on the science front and in the medical and dental communities. So thank you so much for listening to our stories.
Sophia, thank you. Thank you very much. Perfect. We're going to move. I've been told the challenges we have with IT is that to get people queued up for the next person, we have to unmute everybody. And then what we need to do is just for the person who's called, just give a shout out. We'll keep you unmuted, and then we mute everybody back again. It's just the way the technology works. So we're going to go on to Marcella Layton, and then followed by Minda Finney. Marcella, are you there?
So thank you so much for our story.
Sophia, thank you. Thank you very much.
Can you, I'm sorry, I don't want to cut you off here, but I think we're having a hard time hearing you. It's an echo loop.
Mute everybody back again. It's just the way the technology works. So we're going to go on to Marcella Layton and then follow.
All right, that was apparently me. Just kind of winging this, folks.
Sorry, people on the phone, make sure you don't have the webcast on in the background because we can hear it and that's creating the feedback loop. Thank you.
Let's try that again. Marcella, take it away. Okay, how about Minda?
Hi, can you hear me?
Perfect.
Okay. Hi, I'm Minda Finney. I'm speaking to you remotely from my high school classroom where I'm an English teacher in South Florida. I've suffered with TMD since I had my tonsils removed at 16. My jaw was dislocated and locked shut during surgery and didn't resume its function until several months later with medical intervention. By the way, my 40th birthday is next week. Not looking forward to it. Both the dislocation and the barbaric methods used in attempting to pry my mouth open is where my TMJ nightmare began. At this point, irreversible damage had occurred. Through the years, my TMD became worse, increased migraines, special diets, changed when I breathe, walk, etc. My opening on a good day was at a 15, muscle spasms, like the list goes on and on. Unfortunately, most professionals don't know how to deal with a dysfunctional temporal mandibular joint. They don't understand the debilitating pain it causes. Prior to going the surgical route, I tried conservative methods, splints, braces for a second time, muscle relaxers, etc. After the more traditional methods, I had 5 bilateral TMJ surgeries, some of which were unnecessary and caused irreversible damage. But I didn't know it at the time. My last surgery was bilateral TJR orthognathic surgery. Dealing with insurance companies is infuriating and miserable. They look at jaw procedures as cosmetic surgery. I assure you it is not. This, along with my nickel allergy and awaiting FDA approval, bolstered my depression and anxiety. At one point, I felt as though my life was spiraling out of control. Most people, including dentists, doctors, insurance companies, etc., lack empathy towards TMD sufferers. For example, I teach English, and next year I want to teach something that so that I don't have to lecture as much. I studied, passed certification, and then I was told that I was too valuable as a teacher to switch positions. Hence, my health is not valued because the average person doesn't understand how a jaw works, the health issues that it causes, and the pain that I'm in. Unfortunately, this kind of reaction is not uncommon, and this is not the first time I was treated in this manner. As a society, we need more TMD awareness and understanding. We must find a way to educate doctors, insurance companies, and society as a whole about this debilitating disease. As a TMJ community, we need to find ways to inundate the public with correct information about this topic. Knowledge and understanding is key to creating change and empathy. I'm literally the face of TMJ, but what people fail to understand is I fake normalcy every single day. I fake being all right. But in reality, almost everyone in the room that I'm speaking to and everyone who has called in is the face of TMJ because we all have this disease in common. We are among the few that truly gets it. Hopefully this will change, and hopefully together we can create change. Thank you for listening. And by the way, if you want to know what could change, I agree with everything that Karen and the others have said. I think that we're all in this together, and even though our stories are different, we have this one unfortunate commonality. Thank you. Sorry.
Thank you, Minda. We're going to move on to Yolanda Whiteside. Yolanda, are you there? How about Carla Wallback?
Hi. Can you hear me?
Yes, and who are you?
Hello?
Yes, please introduce yourself.
I am Carla.
Carla.
My name is Carla Wall.
Welcome.
Oh, thank you for having me. My story is just like everybody else, but I have some very highly technical things to say, and I'm just going to bullet it off because I realize your time constraint is what it is. The first thing is more women seem to be affected by this as others. And many of us have this started with a procedure where our mouth was manipulated. If there was some way for anesthesiologists to quantify mouth size so they don't hurt us when we're intubated, that would be great. I first and foremost am the victim of fluoroquinolone antibiotics, which were given twice intravenously during surgery and another one. There are multiple black box warnings, and everything I say can be found in the literature. I found with interest TMJ was correlated to high comorbidities of autoimmune disease. I had to wonder after I heard story after story from patients and scientists, physician presentations who were looking at all those systems, how many of these patients were also victims of adverse medication reactions? Number one, fibro was referred to numerous times. I urge you to explore the research of Dr. Annie Oaklander, a neuroscientist from Mass General. Her research supports that many of these fibro patients have small fiber neuropathy, and they are not being diagnosed properly. I am a personal expert in neuropathy, having been devastated by a nerve injury because of the lack of that diagnosis. As I listened to your immunologist, who was using chemotherapeutic agents to prove all the correlations to all the systems, I had to note, fluoroquinolone started out as chemotherapeutic agents. We dismiss antibiotics as some medication that could never devastate a life. We are all too worried about infection and not about adverse reactions. Patients with chronic pain and disease are written off as anxious and depressed. Of course they are, as their lives disintegrate. But it is far more than that. Neuropsychiatric adverse effects are common and have been known for years. Look at pandas. Fluoroquinolones are mitochondrial toxic. Many of our medications are, but the FDA does not require this testing. So I would be interested to know how many of your patients are victims of further destruction during surgery and outpatient by fluoroquinolone. Two other quick things. I'm probably one of the few people that left the country due to this pain and other extenuating factors who got fabulous relief from subcutaneous injections of embryonic stem cells. The other thing I want to have everybody note is that neuroscientists from the NIH called for research for transmagnetic stimulation. That is like taking a jackhammer to an already deteriorating joint. I did that. It made everything 50,000 times worse, and I still suffer from that deterioration. Botox, that's what everybody's using. Who would give somebody Botox who needed joint replacement? I'm thinking that's not a good idea. Why relax a muscle when the joint is unstable? Thank you so much, and I urge you all to explore what I have said. Thank you very much.
Thank you, Carla. We'll move on to Donna Allan, followed by Mark Aggro. Donna, are you on the line?
I am, yes, thank you. Hi, thank you for giving me the opportunity to speak today. My name's Donna. I am a UK NHS patient, and I have suffered TMD in its entirety for the last 20 years. I'm 35 years old and the mother of two children aged 7 and 12. At the age of 14, I was told I needed braces due to several years of tooth removals, attempting to get my overcrowded mouth rectified. My orthodontist at the time advised me that my jaw popped an opening, something that I wasn't even aware of. No one took any ownership to understand why this was happening, not even my parents. Between my teens and late 20s, I had reported many issues with neck, shoulder and head pain. I was misdiagnosed with repetitive strain injury until eventually the correct diagnosis of TMJD was diagnosed. I was given an A4 piece of paper and had a list of do's and don'ts and some very basic exercises to do. Conservative methods did help, but only short term, and things got worse as I began to experience problems with my wisdom teeth. I needed those removed because they were impacted and causing repeat infections. Despite my TMD diagnosis, the surgery was brutal and has left me with permanent nerve damage of my tongue and gum. I am absolutely certain that this surgery made me worse. At 31, my jaw locked and wouldn't open beyond 20 mil. I only had an X-ray and was informed my X-ray was normal, and I had physio, which consisted of a therapist putting her fingers in my mouth and physically pulling my jaw lower down. This went on for months and was pointless and excruciating. I didn't get my first MRI scan until after the physiotherapy failed. My scan, I was advised that both TM joints were totally dislocated. I had severe arthritis. I was considered a Wilks classification 4 type patient. Over the last 4 years, together with my specialist, we have tried joint washout, eminectomy surgery, disc removal with back graft, which was the only surgery that gave me any hope. After 3 months, my opening went from 8 mil to 22 mil. But the headaches came back, and my jaw, although would open, would close with an awful amount of pain and crunching. Today, my jaw is fused to my skull, something I wasn't aware could happen. I am on medicated shakes and under the care of the dietitians. I take dissolvable medication. I need to take laxatives. If I need to vomit because of the medication, I almost choke because I cannot open my mouth to get it out fast enough. I am now waiting TJR replacement of both joints. My order was placed with Concepts in January after almost 12 months of waiting for NHS approval funding for TJR. This condition has shattered my life. I don't go to social gatherings that involve food. I can't read to my children. I no longer do the morning school run because I can't wake up or I haven't slept at all. I no longer share the same bed as my partner. I need to sleep elevated, so I sleep on the sofa. It's the only place I can get comfy. I wake regularly in the night, finding that I have caught my breath due to restricted airways. My 7-year-old has said to me, Mum, I don't remember a time when your jaw didn't hurt. I'm just about holding on to my job, trying to work in between sleeping, pain management and sheer exhaustion. I am worried about my future after TJR. Hearing the stories of everybody, TJR, I'm terrified, but what other options do I have?
Donna.
I think we need to get the message out to all professionals. TMD is real and does ruin lives. Education to not only the professionals but to the public too, mainly on what the early signs to look out for are. I suffer from this condition and I don't even know what to look out for when I'm looking at my children. It would be devastating to hear right now that another 14-year-old is about to face a lifetime of avoidable pain like many of us have endured, and we need to work together to change this.
That's a good place to close it out. Thank you, Donna. Thank you for sharing your message. We're going to move on to Mark Aggro, followed by Kimberly Lancaster. And once again, if I can ask if you pull out your phone and time yourself, that would be of great help. Mark, are you on the line? How about Kimberly Lancaster?
Yes, I'm here.
Take it away, Kimberly.
Go ahead. Go ahead. Yes, this is Kimberly Lancaster. Can you guys hear me?
Perfectly.
All right. Well, just to give a quick background, because we're short on time, as I am a traumatic brain injury survivor with a complex bilateral TMJ problem. I have been through 3 TMJ surgeries. Good on the left, so I'm 1 for 2. I am one of the few success stories. I give a shout-out to Dr. Belay for that today. But I share the same concerns as the other TMJ patients, is there's not a lot of education. I had doctors tell me from ENTs to physical medicine that nobody even exposed them to TMD or TMJ training during their residencies, and they didn't even know what to do with a TMJ patient, and this is 2019. I see people getting unnecessary surgeries where alternative treatments weren't offered, could have failed. I see a lot of greed. I see a lot of engineering of the actual research. If something doesn't go right, they don't want to report side effects. And it really comes down to there has got to be better governing and advocacy, and people have to realize that TMD and TMJ is a whole set of things, not just muscular. You can't go in there and take out a disc. You can cause a hypermobility issue. Like I now have a subluxing right jaw joint, and I've ended up losing a job over it because I wasn't able to keep my joint in place to talk and work. And they don't have to realize that you've got to focus on the overall joint and not try to fix one problem and not fix the other as a complex system. And I do believe that if we work on the educational piece, not just insurance coverage, because insurance wants to cover it once it's sick. They don't want to do anything preventative. They won't want to cover anything alternative. Nobody wants to work on a bite, make sure that people don't get TMJ if they didn't get it from trauma. You know, it's just a lot more. I agree with everybody on everything that's been said. It needs a lot more education preventative, and surgery needs to be more selective and a last resort and not be used in the manner that it's being used. And that's all that I have to add for that today.
Thank you. Thank you, Kimberly.
You're welcome.
Well stated. Mahdi Hassan, are you on the line? How about Tracy Kernan? Alice Fitzgerald? Karen Christie?
Yes, I'm here.
Karen?
Can you hear me?
Yeah.
Yes.
Karen, please go ahead.
Okay. So I feel very fortunate with my status, and I'm very grateful for having the TMJ Association up on the web. That's where I've just recently gone to. A couple weeks ago, I consulted with an oral surgeon, and he told me that I had advanced bilateral degenerative joint disease disorder. I'm not sure, he showed me the scan, and I have no ball and socket. The condyle is shortened and looks like shark teeth. It's edgy. And then my bone looks very porous. So I was told I had TMJ issues 25 years ago. I am a health professional, and I am a health coach. And I'm at this point where I have no ball and socket. The condyle is shortened. Getting feedback, so I'm going to try to talk. My bone looks very porous. I just have to know. I just tried to figure out. I had TMJ issues 25 years ago. Take care of joints. I, over the years, have spent thousands of dollars and hundreds of hours with muscle relaxation and chiropractic adjustments and all sorts of, intermittent therapies because of what I went out and looked for. There was no one ever that sat me down and told me this could be a progressive disease, that if you don't take care of your jaw now, if you don't address the clenching and the bruxism, you can destroy your joint. Obviously, I can see that has happened, but I just feel that I did talk to a surgeon 20 years ago. He didn't allow me to have any questions. He just spatted out orders and left the office. And, of course, I thought he was arrogant and rude and just, a quack, I guess. I don't know. So I'm at the, I just feel like what you talk about, there are thousands of people in dentist chairs that are getting splints made. And I guess there's a percentage of those that go on to further destruction of that joint, while others get relief. And, is a soft splint versus a hard acrylic splint the answer? I don't know, but obviously there's room for exploration and improvement.
Thank you,
all I
Karen.
have to say.
Well done. Thank you. We're going to move on to Mahdi Hassan. Mahdi, are you on the line? Perhaps we'll get Mahdi back on. So let's move on to Margaret King. Margaret, are you there? And just as a suggestion, if you're going to be speaking, you might want to mute your speaker if you're on the web conference, just to avoid the feedback that we've been seeing. Margaret, any chance you're there?
There's any sense. I'm the only one that doesn't know.
Let's go to Laura Howard. Laura, are you there? Paul Redhead.
Can you hear me? Sorry, Laura here. Can you hear me?
Laura, good job. Laura, we can hear you fine. Take it away.
Hello, how's it going? Hello from Ireland. I'm sitting here. The sun is going down. I have some bullet points here that I want to just... I cannot say anything that hasn't been said already. First thing, though, to thank Terry Cowley, because Terry's been so prominent and so helpful. And then also I wanted to mention the Rockabato 6. They are the physiotherapy exercises by Rockabato, and I think they're useful. I'm in Ireland, right? So I wanted to also mention the Book of Quantum and the Irish public body health insurance in Ireland. There's a bigger divide between public and private health insurance. So 50%, like a little bit less than 50% of our population are actually on private health insurance. Getting a diagnosis for a TMD in Ireland is very difficult, and I'll tell you that for sure. And I know it because I've experienced it. I don't think it is pointless to envision a single cause. I won't go into it now. And then what's the distinction? I wanted to ask, what's the distinction between signs and symptoms to the medical community? The mouth is this place where it's this organ of communication. So what's happening in the area of linguistics, speech and therapy, and how doctors interpret signs, the spoken word from the patient. So thanks to everybody for listening. Thanks for this really useful study. I hope it goes well. Looking forward to the report. Ciao, I'm out.
Thank you for bringing your message from Ireland. Enjoy the sunset.
Langefall.
Okay. So let's see. Paul Redhead. Trisha Merritt.
I'm here. Can you hear me?
Yes, is this Trisha?
Yes.
Take it away.
Okay. I'm a TMJ. I never had TMJ pain, but I did have an overbite, which a surgeon attempted to fix with braces and orthodontic procedure. My teeth were ground down. My right joint became displaced and perforated, and the surgeon decided on another procedure and implant. What I want to do, though, is talk about what I'd like to see going forward, and that is research on just what temporomandibular disorders are, research that validates the safety and effectiveness of every treatment for TMD. I want research on every aspect of a TMJ device and related patient care. I want better practices and protocols for all stages of TMJ surgical procedures and formal collaboration with the musculoskeletal sciences in medicine. There's no reason we should not have the research on the TMJ joint that exists like it is on every other joint in the body. Every surgeon who implants a TMJ device must have extensive training. Every device should have a unique identifier so it can be tracked. Manufacturers should come to the FDA with all clinical, bioengineering, biocompatibility, animal, and clinical data to prove safety and efficacy of their product. We need an independent entity to which all explanted devices can be sent for analysis, in which all data submitted, including by patients, can be analyzed and the resulting information credible. I'm just so afraid for all those going forward. I think it starts really from the time that dentists or orthodontists start manipulating the jaws to get the perfect occlusion. It's just something I think that maybe we should look at going forward. I really appreciate all of your attention to this TMD, and excuse me, I'm just nervous. Thank you.
You did great. Thank you for sharing your story. Let's move on to Kathy Dodge. Kathy, are you there? Anna Kuznetsova. Are you there?
Yes, I'm here. Can you hear me?
Yes. Go ahead, Anna.
Okay. So my name is Anna Kuznetsova. I'm originally from Europe, and I'm 44 years old. I'm one of the patients whose TMJ condition was caused by trauma from poorly administered dental treatments, such as orthodontics 2 times in my life, acute trauma caused by a general dentist during a routine dental procedure, which landed me in emergency room with a torn TMJ disc ligament, and trauma from a surgical TMJ procedure called arthrocentesis, which is a joint lavage or flush out, which was poorly executed by supposedly an experienced TMJ surgeon. I would like to mention that arthrocentesis was not indicated for my case, and the risk of the procedure was not properly reviewed with me. Arthrocentesis had the biggest negative impact on my joint's health, causing internal joint bleeding, which leads to scarring inside the joint and damage to the internal joint tissues. It also displaced my discs further. I heard yesterday a surgeon mentioning that arthrocentesis and arthroscopy are fairly safe procedures. Just for the benefit of this committee, these procedures are capable of causing severe physical damage to the patient, and some of the damages that we have seen with these procedures were perforation into medial cranial fossa, leading to permanent brain injury, nerve damage, synovial membrane damage, hearing loss, further disc displacement, joint scarring, and other. So these procedures have to be performed by highly skilled surgeons, which specifically specialize on performing a minimally invasive TMJ surgery. It cannot be taught in a weekend seminar or a mini residency program, which I now see conducted by TMJ, American TMJ Surgeons Association or community. And as a patient, it makes me really worried that we are preparing surgeons this way. Since I got hurt, I started doing my own TMJ research. Over the last 8 years, I have read numerous articles. I was recording and tracking stories that patients shared. And some of the things that I noted, there are definitely patients whose TMJ originates from systemic conditions, such as systemic arthritis and other. But there is a large group of patients where the source of TMJ dysfunction is originating from trauma, and it could be either micro trauma or macro trauma. Some of the sources of trauma that patients reported were undergoing jaw surgery, TMJ injury during wisdom tooth extraction, and I think you've heard several examples of that during this discussion. Orthodontics, full mouth restorations, occlusal splints that cause functional imbalances and change the bite, intubation during a medical procedure unrelated to TMJ, car accidents, and other types of accidents leading to trauma of the head, neck, and upper body. So I think we need to be careful in defining TMJ dysfunction as a systemic disease, because there are many different causes for TMJ dysfunction and how people acquire it. From my perspective, I think the low-hanging fruit right now is to investigate deeper the current TMJ treatment strategies, both surgical and non-surgical, look into current dental practices, and assess the validity and clinical quality of the dental and TMJ care provided to the public. As a patient, I don't see any good practical solutions for TMJ treatment available to me. Many dental professionals lack the breadth of knowledge needed to properly diagnose and understand TMJ dysfunction.
Anna, I'm sorry to cut you off here. We're a bit over time, and really appreciate you taking the time out to share your story. We're going to move on to, we're going to try to be creative now, and Mahdi Hassan is calling into Olivia's cell phone, and we're going to see if we can broadcast through her cell phone through the microphone. So we're going to run a little experiment. Mahdi, if you can hear us, please go ahead.
I can hear you. Can you hear me?
Yes.
Okay, that's great. First, I want to thank you for giving me the opportunity to talk. I am Mahdi Hassan, and I am from Omaha, Nebraska. I am suffering from TMJ. I have constant pain in my jaw, and it's getting worse day by day. So it's really difficult for me to talk, laugh, and eat. I have a 15-month-old daughter. When I go home from the office, I don't like to talk to my wife and my daughter because of the pain. I'm really, really scared of getting permanent disabilities after hearing all the horror stories from TMJ sufferers. Every day I think, what will happen to my family if I disable, as I am the only remaining member of my family. So I will have a couple of questions to the committee. First, stress and anxiety is considered one of the main reasons for TMJ. When patient found out that TMJ is not covered by the insurance policy, I believe it makes those patients more stressed and symptoms getting worse. Why we are not taking initiatives to add TMJ benefits to every single insurance policy? Why private policies need to take TMJ benefits as an additional benefit? Why there is no FDA-approved protocol to treat TMJ? I also have noticed that lots of dentists take the advantages of the TMJ patients. I believe these patients are one of the most vulnerable populations. They make orthotics to treat TMJ patients. The cost of making an orthotic is in between $3,000 to $7,000. Patient need to pay the amount that it doesn't matter whether it hurts them or not. Sometimes the orthotic makes the symptom worse. why we don't make a guideline for the dentists to make sure that they're not taking the advantages of those vulnerable population. Thank you.
Marty, thank you very much. Glad we could work that out. Michelle Casada, are you on the line?
Michelle Casada. Can you hear me? Okay.
Yes, is this Michelle?
Okay. Yes, it is.
Go ahead.
Okay. My name is Michelle Casada, and I'm a professor at Wayne State University. I am also one of the many patients where my TMD was caused by trauma and not genetics. I now have had 10 plus surgeries, and I have awful daily blinding, crushing, burning, electrocuting pain and migraine. My trauma was from a surgeon doing jaw surgery in 1989. It was not based on my genetics. The surgery closed an open bite that was caused by orthodontics when I was 10. It has now been 30 years since my first surgery. As a young adult, I had few headaches, but I never had any jaw pain. So I was convinced that I needed an osteotomy. So my maxilla was broken and thawed, and then the jaw pain started. I started having more and more migraines and jaw pain, and I had many complications from this surgery. This was trauma. I was led on a gerbil wheel of an industry that lacked standards. As you know, there is no standards in TMD, none. 30 years ago, when I was a young adult, there were no standards. Things have not changed. In 1990, the surgeon recommended arthrocentesis and 4 other open joint surgeries, and then I formed bone spurs as a reaction to the surgery in the small joint. In 1992, I had the disc removed and was told this was founded in science. It was not. I ankylosed. My bone grew and fused to my skull. My face looked like stone. I went from doctor to doctor and dentist, and they told me that there was no science to wait. So I waited 20 years to have joint replacements, and nothing had changed. I was desperate. I developed an infection in the joint 3 years before it was diagnosed. The surgeon was not familiar with biofilm. I had to bring in the scientific research to show him, and then he finally cultured my joint. He pulled it, and it was indeed infected. So I've been on so many PICC lines and antibiotics, hyperbaric oxygen, so many treatments. The joint was replaced, the infection returned and still remains. It's 2019. The implant on the right is loose. My surgeon retired, and here I am. I'm scared. Do I wait another 20 years until there's science? I'm 53 years old right now. Change is desperately needed to save your mothers, children, sisters, neighbors, brothers from procedures that lack real research. We need neurologists, infectious disease, medical doctors, and craniofacial surgeons. I run a board of almost 1,500 patients. There are so many people hurt. There's strokes, brain bleeds, hearing loss, nerve damage, pain. There's suicides because of pain. Medical doctors must be involved. There are no standards in TMD. None. 30 years. None. No standards. Why? Please implement standards. Please. I'm begging you. Please help us all. Thank you.
Dr. Casada, thank you very much. We're going to do one more run through from the top on down for those who weren't able to speak before, and then we'll close the session out. So I'm going to go back from the top. Ariadne Braz, any chance you're on the line? Yolanda Whiteside. Mark Aggro. Tracy Kernan. Alice Fitzgerald. Margaret King. Paul. She's there? Was that Margaret? Margaret, are you there? Paul Redhead. Kathy Dodge. Okay. So we did. And then lastly, Marcella Leighton, or Leighton. Thank you. All right. We've we've gotten through everybody that we could get the connections to work. For those of you who were not able to speak, that wanted to speak, or for those of you who are just on the line and like to provide additional commentary, you can send an email to us at tmdstudy at nas.edu. That's tmdstudy at nas.edu. I believe that's also posted on the National Academy website. I took away a lot from this. These were some incredibly powerful stories, and I think all of us were educated and impacted. And you know, some of the things that I took away from this are that while there are strong commonalities in most of these messages, that everybody's story is unique. Everybody's an individual here and has experienced their own journey through their path of getting appropriate assessments, treatments, and the impact, clearly, that it's had on the amount of suffering that people have had. I was impressed with the people calling in internationally. This is clearly a global problem. It is not confined to the United States or even to just the developed countries. And it's clear that we can learn from each other. And there's an opportunity here to learn from our international colleagues and vice versa. That pain clearly is impacting what we heard from caregivers, not only the patient, but also their entire family and their friends. And once again, we get back to the issues of social isolation. There is a call out for greater increase in knowledge about TMD. There was a striking preponderance of women who this affects, and that we heard from today. But towards the end, we also did hear that it clearly affects men as well. The bottom line is TMD doesn't discriminate. It doesn't discriminate based on sex, on geography, on education. Anybody and everybody can get it. You shared with us the challenges that you faced with multiple surgeries, medication reactions, the procedures that have gone wrong. And some of you have shared some of your success stories, and thank you. You've also shared with how many of you have had to go outside the system because the system didn't work for you. And we got that. There are clear problems with assessment of this condition, and we need to improve that and improve the pathways. There was messages about TMD not being a single thing, but that we need to focus on the entire person and all the problems associated with it. A repeated message about needing improved education for the clinicians, also the patients. We need to self-empower the patients. There was some specific call-outs about the challenges with surgeons, and also anesthesiologists kept popping up around the issue of intubation. Several patients had concerns about feeling invalidated by their clinicians, disrespected, that their clinicians were rude. Clear opportunities here for us to help advocate for improving communication with clinicians and patients. And then a need for research on this problem, that there's a tremendous lack of knowledge from the basic science, the translational science, the clinical, on causes, preventions, and treatments. And there's just clear desperation for improvements and translation of that research into things that will be safe and effective. So I want to thank each and every one of you that shared your story with us. We took a lot of notes. We heard you. Again, for those of you who want to write in, tmdstudy at nas.edu. With that, I'm going to turn it over to Dr. Bond to close out the session or add any further comments.
So I would just say I think this has been a remarkable workshop. We've had splendid interaction with the patients who have helped us really understand and clarify some of the important things we now have to spend time on over the next several meetings. I thank everybody who's participated in this, and we will go to lunch and then reconvene as a committee here, right? Please, at 12:15. Thank you, everybody.